Let's bring Ashley out. Ashley?
Hi.
Hi there. We've talked so much about patient-centered care and patient-centered strategies for reforming and disrupting healthcare.
There we go.
You've got a couple of things to say about that, right?
A couple.
Ashley Jagodzinski?
Yes, correct. We were actually just talking about that backstage. It's a long Polish last name with the D and a Z next to each other, and people freak out. So it's always good when people say it correctly. Jagodzinski.
It's a kind of a bi-vowel kind of name.
Exactly.
Yeah.
I learned a lot of the consonants early.
Yeah. Now, let's just start right there. How many times in your encounters with the healthcare system has somebody misspelled your name?
Misspelled?
Let's just start with misspelling.
Misspelled? None that I can think of.
Really?
Really?
Wow.
I know.
That's amazing. How about mispronounced?
I think we should say how many times have people said it correctly would be a better question, and very few and far between.
So I've done pretty well here.
You've done excellent.
So describe to me your healthcare situation, because it's not completely apparent to me what your sort of medical situation is. How come it is the case that you've been a patient since very early in life?
I've been a patient before I was even born. So my mother was living here in Rochester with my father, and she went to a routine prenatal ultrasound, and the ultrasound showed that I had a heart defect. So I have 3 of the 4 chambers of my heart. Okay, so the 4 chambers that you need for your heart to function, I only have 3. So they knew I'd need to have some open heart surgeries. The first open heart surgery I had was when I was 6 months old. The next was when I was 3, which was a Fontan procedure. Mom's in the audience really happy that I remember what it was called. Yes, aren't you? Yeah.
Say that again,
a Fontan procedure. Which is basically, as Mom explained it to me, rerouting of the oxygen in the blood flow, to my lungs so I could breathe.
So somebody came to your mother and said, yeah, we're going to cut your daughter open and we're going to reconnect her veins and arteries so that she can breathe.
And live.
And she said, fine, go right ahead.
Yes, she did.
The alternative is unspeakable.
Yes, so we won't speak of it.
When were you first aware that you were a patient?
Oh dear, young. I want to say 4. Yes, 4. I have very, very vivid memories of going to physical therapy, because I was also diagnosed with juvenile rheumatoid arthritis when I was 2, also here by Dr. Thomas Mason, who is now currently my rheumatologist. So we've done a 360. He diagnosed me, then I went away for a bit. Now he's my rheumatologist again. I just love that story. Nerd.
So you have a community of
I have
doctors.
a community.
Right.
I have a community, but I remember going to physical therapy with Mom, and the biggest issue with me growing up with JRA was for me not to turn out like my aunt, who was born as well with RA, and she didn't have the wonderful advanced medical technologies. So her hands, I don't like the C word, but they looked kind of like this. And what I would do in physical therapy is I have this vivid memory of taking a measuring tape and pulling it, because I was able to grasp, and then intricate detail, I remember that from when I was 4. And I also remember taking prednisone. It was a liquid, and hating that taste because it's pure alcohol. At least that's what it tastes like.
Some people actually don't have so much of a problem.
I know, but I did at 4, and I wanted ice cream directly afterward.
Exactly. All right.
And I did.
So when did the healthcare system scare you? When did it seem to nurture you? And describe the difference in those experiences.
Okay, I think my entire life I've been nurtured by the healthcare system. I've always had very great, wonderful, fabulous, fantastic doctors and nurses, physical and occupational therapists, team, nurses, everyone around me. They've always been nurturing, very complimentary, very helpful. The first time I was ever scared was 9 years ago in July. It was always July 4th when we'd come back from Arizona, when they told me I needed to have my 3rd open heart surgery when I was 12. That's when it kind of kicked in of, oh, I will need to have another open heart surgery. to fix this leaky valve I knew I always had, but it was when I was like way older, like 16, 17, and it was 12. And that's when I realized, okay, this is scary. And that was a very, very traumatic experience. There's still traumatic memories that I have, but it's made me the person I am today. So I don't look back at it with any regrets or think it's scary at all.
But suddenly, the doctors who had been nurturing you all along were going to do an operation that you knew you had to have. What did you need from them suddenly, as you, suddenly this young woman, are able to contemplate at 12 what exactly they're going to do to you?
What did I need from them?
What did you need from them in terms of reassurance or some
yes.
kind of coaching, something like that?
At 12, I was very quiet, and I wouldn't show that kind of emotion to doctors. So I definitely would ask my mom, are you sure I'm going to live? Are you sure I'm going to be okay? Because it's heart surgery. It's open heart surgery. And Mom, of course, would always assure me and say, yes, you're fine. I didn't go to my doctors, especially because I was 12 and kind of shy young girl. I didn't have the voice that I do now to say, hey, we need to talk about this procedure that we're having. I'd like to know more. That was more Mom and Dad's area at a very young age.
So when did you develop that voice? And could you give it to me again, just to look out at the audience and give that face?
What face?
The, hey, we have to talk about this procedure I'm going to have here, that one that you just gave me?
Hey, we need to talk about this procedure I'm going to have. That actually happened right after the heart surgery. So I was 12. I was going to middle school. And I had just had heart surgery. I missed a month of school. Great. It was totally popular. But I needed to know what medications I was on, what would happen if I needed to go to the nurse. I was very close with the nurse. She was amazing. I needed to know everything that had happened to me at that point in order to survive by myself at school. So that's when I really took an active role. And from 15, I remember 15, because I went to an online high school. So Mom and Dad would go to work. I'd be home by myself doing my own schoolwork, which worked out better for me with the 2 chronic conditions I have. Online school is amazing. I love it. Go MNVA. Sorry. 15, I took my meds by myself every morning, every night. I would check when I was 13, 14 years old to make sure that my meds were correct. Mom and Dad would lay out my meds for me. And I remember going, okay, Mom, this is DIG. I need folic acid. They look the same, but this one's just a little bigger and this one's a little smaller. So I would correct them, and we'd always have to have an open dialogue because I'm on Coumadin, or an anticoagulant. So around 12 is when I really started to become aware and become more involved because I needed to.
And do doctors go along with this? Do nurses go along with this? Do they accept your expertise here? Do you, can you really sort of tell what it is they need to be doing sometimes?
I think at 12, it was more Mom and Dad's area of specialties. That's where they kind of...
Were they advocates?
They were advocates, yes. They were talking for me. And then when I was 17, and I was living here, 18, excuse me, and I was driving myself, that's when I became an advocate for myself and said, hey, this is what I need from you, this is what's going on. But I had very wonderful doctors that always wanted my input, no matter what.
You're very lucky. And,
Yes, I am.
And there's been a lot of criticism, not of doctors particularly, but just of the system.
Yes,
What do you
yes.
think the system gets wrong about someone like you?
Gets wrong? Well, I actually talked about this with Mom. I'm sorry, I'm referencing Mom a lot 'cause she's been here through everything the last 21 years. But when Mark...
Never forget.
Never forget. Oh, gosh,
Never
no.
forget.
Dad was there, too. It was just always Mom that was there.
We understand.
And Mark, I'm going to butcher his last name, so I'm not even going to try to say it. But he talked about navigating the system. And I talked with Mom, I go, was it hard to navigate? And Mom goes, we got through it together. So navigating the system is very hard, especially now that I have to navigate it by myself. I'm taking that role in my life. It is very scary. But like Mom says, we got through it together, no matter what.
What scares you most? The possibility that your heart could fail, or the possibility that the system could fail you?
I don't look at it as a system could ever fail me. I think I've been through too much and have too many positive experiences where I don't think the system could fail me. I don't think my heart could fail me either. I don't see a failure at all. I'm very positive, which is about this experience, which I hope is a good thing, and maybe not exactly what we've been hearing, but from my point of view, it's always been very positive.
What's the message that you would give to doctors and to healthcare institutions and providers that they need to remember when they are dealing with patients, when they're thinking about strategies that involve patients? People are going to have a continuing long-term relationship with their healthcare provider.
Talk to them, like you and I are talking. Make sure they understand what's going on and value their opinion. I've had really wonderful experiences, and then I've had some not great experiences. All my wonderful experiences have been at Mayo. My not so wonderful experiences have been in Arizona, where they didn't value my opinion. They didn't believe me when I said I was in as much pain as I said I was, and I want to feel heard. So all the doctors and nurses, hear your patients, make them feel heard, value what they're telling you.
What's the silliest experience you ever had when somebody got something wrong, or maybe it was a not positive experience, not a terrifying experience, but just when you said you had a few funny stories of what happened. Tell me one.
Okay, there's a difference between just a random funny story and a silly where people got it wrong.
Right, let's hear the latter.
Let's hear
Silly,
where someone got it wrong. Again, this was not Mayo, this was in Arizona, and
It
unfortunately—
can be Mayo, it's okay.
It is not okay. Mayo has saved my life. It's
You are
not okay.
the M team, right?
I am the M team.
You're not Sriracha, you're Mayo over there, right?
Yes.
Yeah, okay,
Yes.
Anyway, go tell the story.
Oh, I just got it. I'm sorry.
It's corny, don't worry.
I love corny.
Yes, you are a nerd. I love corny, that's a t-shirt. Okay, go.
I was in Arizona, and unfortunately, they don't have any pediatric rheumatologists, so we had to go and see an adult rheumatologist. And what they did was take my blood at the location. And I got a call later that night, not from my doctor. My dad answered it, and I heard my doctor speaking on speaker going, "Is there anything she's going through right now, like emotionally? Because her blood is fine. And what she's telling me, she's had a lot of pain. From her blood, she's fine. Is there anything emotional going on?" I talked to my dad after, and I go, "There's nothing emotional going on." Turns out, they switched my blood with some other lady from the previous morning who was fine. I was not. He called, said, "We're very sorry," and eventually I got the help I needed.
So the first possibility was you were having emotional problems.
Yes, because I was in high school, and I'm a girl.
All right. Don't worry, Mom. He makes that noise all the time when we're on stage talking together. Finally,
Yes.
you've been anesthetized a bunch of times, right? You've been fully.
Oh, yeah.
Fully.
I prefer it.
You prefer it. It is so relaxing. It really passes the time, anesthesia. Whose face, besides your mom, in the healthcare world, are you most comfortable seeing? Would you most prefer to see as you fall asleep when they say, "Okay, count backwards from 10"?
I love all my doctors, but it's going to be Dr. Spolka, my pediatric rheumatologist, who's been with me for, how old am I? 21, minus 6, 15 years.
But you're 21 now.
It's crazy.
I don't know. You can't have a pediatric rheumatologist.
I'm working on it. I am. I'm meeting with Dr. Spolka next summer, as well as another doctor from adults, and we'll make the transition. But I wanted to officially say goodbye to Dr. Spolka because it's 15 years. I can't just say bye. I need to have some closure, some tears.
And as RA and open heart surgery teaches us, as far as pediatricians and adult doctors are concerned, we never want to grow up, and that includes you, right?
Right.
You want to keep that pediatrician forever.
Because there's a relationship there. It's 15 years of a relationship. I trust her with my life.
Which is the best takeaway of this entire 3 days. Ashley, thank you so much.
Thank you so much. Thank you.